Hey, there all viewers. Welcome back to another healthy lifestyle supports channel video. What is dehydration? What causes dehydration? What is the care for dehydration? Anyone may become dehydrated, but the condition is especially dangerous for young children and older adults. The most common cause of dehydration in young children is severe diarrhea and vomiting. Older adults naturally have a lower volume of water in their bodies and may have conditions or take medications that increase the risk of dehydration. In today's video, we will show you the common symptoms, causes, and risk factors of dehydration, especially how to prevent of dehydration. Please watch till the end to learn about all of them. Number 1. Symptoms of dehydration. Before we elaborate on the symptoms of dehydration, we should know what is dehydration first. Dehydration is a condition caused by the loss of too much fluid from the body. It happens when you are losing more fluids than you are taking in, and your body does not have enough fluids to work properly. Well, what are the symptoms of dehydration? Thirst isn't always a reliable early indicator of the body's need for water. Many people, particularly older adults, don't feel thirsty until they're already dehydrated. That's why it's important to increase water intake during hot weather or when you're ill. The signs and symptoms of dehydration also may differ by age. 1. For infant and young children, the symptoms of dehydration include dry mouth and tongue, no tears when crying, no wet diapers for 3 hours, sunken eyes and cheeks, sunken soft spot on top of the skull, and listlessness or irritability. 2. For adults, the symptoms of dehydration include extreme thirst, urinating and sweating less than usual, dark-colored urine, fatigue, dizziness, dry mouth, dry skin, dizziness, and confusion. And 3. Dehydration can be mild, or it can be severe enough to be life-threatening. Get medical help right away if the symptoms also include has had diarrhea for 24 hours or more, be irritable or disoriented and much sleepier or less active than usual, can't keep down fluids, rapid heartbeat, rapid breathing, and has bloody or black stool. Number 2. Causes of dehydration. What causes dehydration? Sometimes dehydration occurs for simple reasons. You don't drink enough because you're sick or busy, or because you lack access to safe drinking water when you're traveling, hiking or camping. While other dehydration causes include 1. Diarrhea, vomiting. Severe acute diarrhea, that is, diarrhea that comes on suddenly and violently, can cause a tremendous loss of water and electrolytes in a short amount of time. If you have vomiting along with diarrhea, you lose even more fluids and minerals. 2. Fever. In general, the higher your fever, the more dehydrated you may become. The problem worsens if you have a fever in addition to diarrhea and vomiting. 3. Excessive sweating. You lose water when you sweat. If you do vigorous activity and don't replace fluids as you go along, you can become dehydrated. Hot, humid weather increases the amount you sweat and the amount of fluid you lose. And 4. Increased urination. This may be due to undiagnosed or uncontrolled diabetes. Certain medications, such as diuretics and some blood pressure medications, also can lead to dehydration, generally because they cause you to urinate more. Number 3. Risk factors of dehydration. Who's at risks? Anyone can become dehydrated, but certain people are at greater risk. 1. Infants and children. The most likely group to experience severe diarrhea and vomiting, infants and children are especially vulnerable to dehydration. Having a higher surface area to volume area, they also lose a higher proportion of their fluids from a high fever or burns. Young children often can't tell you that they're thirsty, nor can they get a drink for themselves. 2. Older adults. As you age, your body's fluid reserve becomes smaller, your ability to conserve water is reduced, and your thirst sense becomes less acute. These problems are compounded by chronic illnesses such as diabetes and dementia, and by the use of certain medications. Older adults also may have mobility problems that limit their ability to obtain water for themselves. 3. People with chronic illnesses. Having uncontrolled or untreated diabetes puts you at higher risk of dehydration. Kidney disease also increases your risk, as do medications that increase urination. Even having a cold or sore throat makes you more susceptible to dehydration, because you're less likely to feel like eating or drinking when you're sick. And 4. People who work or exercise outside. When it's hot and humid, your risk of dehydration and heat illness increases. That's because when the air is humid, sweat can't evaporate and cool you as quickly as it normally does, and this can lead to an increased body temperature and the need for more fluids. Number 4. Complications. Dehydration can lead to serious complications, including 1. Heat injury. If you don't drink enough fluids when you're exercising vigorously and perspiring heavily, you may end up with a heat injury, ranging in severity from mild heat cramps to heat exhaustion or potentially life-threatening heat stroke. 2. Urinary and kidney problems. Prolonged or repeated bouts of dehydration can cause urinary tract infections, kidney stones, and even kidney failure. 3. Seizures. Electrolytes, such as potassium and sodium, help carry electrical signals from cell to cell. If your electrolytes are out of balance, the normal electrical messages can become mixed up, which can lead to involuntary muscle contractions, and sometimes to a loss of consciousness. And 4. Low blood volume shock, hypovolemic shock. This is one of the most serious, and sometimes life-threatening, complications of dehydration. It occurs when low blood volume causes a drop in blood pressure and a drop in the amount of oxygen in your body. Number 5. Prevention. To prevent dehydration, drink plenty of fluids and eat foods high in water such as fruits and vegetables. Letting thirst be your guide is an adequate daily guideline for most healthy people. People may need to take in more fluids if they are experiencing conditions such as 1. Vomiting or diarrhea. If your child is vomiting or has diarrhea, start giving extra water or an oral rehydration solution at the first signs of illness. Don't wait until dehydration occurs. 2. Strenuous exercise. In general, it's best to start hydrating the day before strenuous exercise. Producing lots of clear, dilute urine is a good indication that you're well hydrated. During the activity, replenish fluids at regular intervals and continue drinking water or other fluids after you're finished. 3. Hot or cold weather. You need to drink additional water in hot or humid weather to help lower your body temperature and to replace what you lose through sweating. You may also need extra water in cold weather to combat moisture loss from dry air, particularly at higher altitudes. And 4. Illness. Older adults most commonly become dehydrated during minor illnesses, such as influenza, bronchitis, or bladder infections. Make sure to drink extra fluids when you're not feeling well. Of course, the only effective taking care of people with dehydration is to replace lost fluids and lost electrolytes. The best approach to dehydration take care depends on age, the severity of dehydration, and its cause. For infants and children who have become dehydrated from diarrhea, vomiting, or fever, use an over-the-counter oral rehydration solution. These solutions contain water and salts in specific proportions to replenish both fluids and electrolytes. Most adults with mild to moderate dehydration from diarrhea, vomiting, or fever can improve their condition by drinking more water or other liquids. Diarrhea may be worsened by full-strength fruit juice and soft drinks. If you work or exercise outdoors during hot or humid weather, cool water is your best bet. Sports drinks containing electrolytes and a carbohydrate solution also may be helpful. Children and adults who are severely dehydrated should be treated by emergency personnel arriving in an ambulance or in a hospital emergency room. Salts and fluids delivered through a vein, intravenously, are absorbed quickly and speed recovery. That's all now. What did you learn from the symptoms of dehydration? Let us know in the comments section below. Enjoyed this video? Please hit the like, share, and subscribe to my channel by turning on ring the notification bell below if you want to see more content like this. Thanks for watching this video from the beginning to the end. Stay healthy, eat healthily, be healthy.